Hey, it's Mike here, and today, another heart disease reversal video. Do we need another one? Probably not. I'm making it anyway. If you're following my community post, you probably saw that there was going to be a pretty epic debate, and it was then delayed, and now it's officially canceled, unfortunately. We don't need to focus on why it got canceled. I'll just say that it crumbled from both sides. Dean Ornish was always ready to go till the end, but there was scheduling issues. There was a lot of issues, and it's canceled. And all that's not that important. What's important to me is where I am in terms of the official proposition, which is a plant-based diet has been clinically shown to reverse heart disease. What are my current thoughts on this? What have we learned? So I want to basically state my position and the research that I believe supports it. For those who are a little lost, we had an epic debate set up where we were going to have Dr. Dean Ornish and Dr. Esselstyn on one side debating for reversal against the younger doctors, Dr. Avi and cardiologist Danielle Bellardo, and is going to be moderated by the former president of the American College of Cardiology, Dr. Kim Williams. I was just going to do technical stuff. And to keep things clear, the young doctors, let's just call them the anti-reversal party, are not anti-plant-based diet. They're both vegans as far as I know. And they just think that there isn't enough evidence to show for sure that there's reversal. They are still in support of a vegan diet, plant-based diet for the treatment of heart disease. We all agree that it lowers mortality in events. So if any low carbers want to spin this, you're just dishonest. All right, moving on. To sum up the anti-reversal camp, they just think that angiograms aren't good enough and that we need newer imaging to show for sure that there's reversal. And I'm going to address angiogram validity in this video, but I think that's a fair representation of their position. Moving on. So a few weeks back, I went on a live discussion with the young doctors, and I have no problem admitting that I was unable to put forward good enough evidence that we have reversal based off the standard that they put forward, which was a quote from a study saying that regression is greater than 10% absolute stenosis regression, and stenosis, of course, is that plaque lesion, and that was in less than 2 years, also including a 0.2 millimeter or greater increase in minimal luminal diameter, which is the shortest point between the inner walls of your arteries at that stenosis point. So I conceded that point, but I think I also said I personally believe that a vegan or generally plant-based diet reverses heart disease just based off other things. But I was like, yeah, I probably need to revisit this claim. But then over the next few days and week or so, I started realizing that I did not feel good about believing something that I was not able to show, and that just kind of ate me up inside. In that discussion, I presented a larger view of what heart disease and heart disease reversal is, and in good faith, I allowed that to be shot down because you have a cardiologist saying, you're wrong. I was like, fine, I'm wrong. But after looking at the data more and more, looking at various studies, looking at various aspects of heart disease, I have flipped my position back. I do believe that we've clinically shown heart disease reversal with a plant-based diet, so they're going to be really disappointed with me. Anyway, moving on. To their credit, I think it's great to challenge just general plant-based or vegan notions, and I have learned a lot, and I definitely am going to approach the way that I talk about reversing heart disease differently. For example, that certain people might take heart disease reversal to mean absolutely ditch all modern medicine, go off all medication, and refuse all surgery, which is very clearly not going to lead to your highest chance of survival. But at the same time, in terms of the truth of the human body and in terms of what you're recommending people to do, if we have a Venn diagram saying a plant-based diet reverses heart disease and ditch all Western medicine, go off statins and go off everything, these are not the same statement. They don't overlap. I personally think that moving forward in the plant-based movement, there's room for both of those statements together. I don't see why not. Anyway, let's get into my general philosophy on this. I personally follow what could be described as a comprehensive definition of heart disease reversal that goes beyond just stenosis size. We're talking a multifactorial disease, which is what heart disease is, which includes not just volume of stenosis, but also the morphology and the stability. We're talking endothelial function, inflammation, blood flow and heart power, and outcomes in terms of death and event rates. I think most would agree that the reversal ability of an intervention would not just be based on a single metric. It would be based on the entire bulk of the literature and various aspects of the disease. I mean, if you're going to assemble the best panel of experts to decide whether or not a diet or intervention reverses heart disease, no, they're going to be looking at all of the evidence. And while we're talking about authorities, I just need to mention that Ornish's program is Ornish's program for the reversal of heart disease, which has been either endorsed directly or accepted. The reversal part has been accepted by some pretty major medical authorities. Real quick, we're talking The Lancet, where his work has been published, #2 medical journal with reverse in the title. Also, the National Heart, Blood, and Lung Institute of the NIH funded the study, And I would be shocked if they didn't know that the title said reversing heart disease in it. And if they really cared, I think they would probably have a correction there. Ornish's program with reversal of heart disease in the name is paid for by Medicare. Medicare calls it reversal themselves. Finally, in the Harvard Heart Letter, you can see it explicitly stated that heart disease reversal is possible in the context of Ornish's program. And you're probably thinking that sounds like an appeal to authority. And to that, I have to say absolutely, because the reversal definition that we ultimately decide on is going to be subjective. So you're either going to go with an authority or just go with your personal belief. We're stuck with that. And it's not just a bunch of vegan, ethically motivated doctors using this reversal terminology. It's some pretty major medical authorities. But back to stenosis, for a simple and kind of mediocre analogy, it's like asking whether or not automobile deterioration can be reversed, but then you only look at the odometer. I mean, there's clearly way more to that. If we only had one metric to look at, if we could only look at stenosis, then yeah, that's as limited as our view is, but we have so much more. And a simple example of why stenosis isn't everything, imagine there's a new drug on the market and it rapidly reduces stenosis volume. It just 10% a week gone, but it destabilizes so rapidly that it increases heart attack rate and death rate by like 20 times. Clearly, it is not reversing heart disease. Stenosis alone can never tell you either way, so we have to look at the whole picture. All right, here's a snapshot of the comprehensive view of heart disease reversal I'm talking about. It doesn't include everything, just for simplicity's sake. You have that regression, which I will defend in a bit. You have those lower CAD rates, lowered by 60% in the Ornish study. Esselstyn's rate was lower. That was possibly due to higher adherence, possibly due to some statin usage as well, but not randomized controlled trials, so I'll just leave it out for now. Now, we have lower angina or chest pain episodes by 91%. We see lower inflammation level in people with heart disease by about 30% pretty quickly. Big part of the picture. We see that increased blood flow in the heart, and we see improved endothelial function by several metrics. And here's a 2017 paper that really sums up the comprehensive reversal idea in the Journal of the American College of Cardiology, written by Drs. Ornish and Dr. Kim Williams, who I know the Anti-Reversal Party respects, as well as others. Talking about Ornish's studies, they say significant reversal in coronary heart disease as measured by improvements in ventricular function using radionuclide ventriculography, a 400% increase in heart blood flow using PET scans, regression in coronary atherosclerosis using quantitative coronary angiography, and 2.5 times fewer cardiac events when compared with a randomized control group. So with that in mind, it's pretty clear why I reject the propositions in their syllogism, which is a layout of their logical argument based on their minimization of heart disease in general. But I particularly reject the 0.4 millimeter minimal luminal diameter cutoff, which the whole argument hinges on, and I will cover that in detail later, as well as the validity of angiograms in a bit. But first, to the hill that I died on a few weeks back, the 10% regression quote. It seems that the Anti-Reversal Party has abandoned this anyway, but I still feel a need to address it. Again, we're talking greater than 10% absolute stenosis regression in less than 2 years with that opening up of the arteries of 0.2 millimeters or greater of the inner lumen. Now, the study we all had our eyes on in the discussion was Ornish's Lancet paper, the most recent one. And no, it didn't break that 10% threshold. It also just didn't mention what percent of the people broke the 10% threshold. However, it became clear to me later that there is a study a few years back. This is the same lifestyle heart trial just earlier, but it looks at some different things and was published in the American Journal of Cardiology. In this study, they found that greater than 10% diameter stenosis regression was broken in 41% of subjects. All of the angiograms were done within less than a 2-year period as well. I think that's an arbitrary time mark, but whatever, they did it. While milder stenoses didn't have much of a minimal luminal diameter increase, severe stenoses averaged a 0.17 millimeter increase, which means half of them were over a 0.17, so a 0.2 millimeter change certainly occurred. In terms of the debate motion, not everyone has to have reversal, it just needs to be shown. So a plant-based diet has broken this threshold, that's met this definition for reversal of stenosis. However, there's many problems with this definition. First of all, it's somewhat arbitrary. Second of all, it's plaque regression. It never mentions heart disease overall. There's logical issues as well. For example, one way to diagnose heart disease is a 20% or greater absolute stenosis. So if somebody goes from 29% to 19%, they've technically crossed the threshold of having heart disease to not having heart disease, and that wouldn't count under this definition. In addition, you could have a 50% absolute stenosis regression in 2 years and 1 month, also wouldn't count. You get the point, but it appears that they abandoned that 10% statistic anyway and instead have put in their syllogism a 0.4 millimeter lumen diameter or greater increase to show reversal. And that's from this 2007 paper, and in particular appears to be from this paragraph where it mentions 0.4 a lot. Again, this appears to be subjective. They say that this 0.4 millimeters is taken to represent true change, whether progression or regression. Why did they double what is accepted by many other scientists in many other papers, what they were initially pushing? You get what I'm saying? And it becomes clear when you realize that they're just following the recommendation of a 1993 study, which found about 0.19 variability between somewhat longer term angiograms. And they said, to be safe, let's just double that when something over 0.2 would be more than that variability. Then there's the book QCA in Clinical Practice, which actually compiled a table with different definitions used for regression in other studies. There's so many definitions. Which one do you choose? They even made a definition for Ornish. Some researchers chose the 10% stenosis regression, and at the bottom, some chose the 0.4 minimal luminal diameter one. Again, this is subjective. I'll continue to make the case for angiograms, but it's become clear, especially on the Vegan Gains Live, if you saw it, that the main angle here is now that angiograms aren't actually capable of measuring plaque, therefore they're completely useless in that sense anyway. And the main argument there is that when you're looking at other imaging methods that are better, they don't necessarily line up. And it's clear that Ornish and his colleagues were out to prove that there was regression and make a good case for it. And so they went above and beyond angiograms in certain ways. We're going to cover those in a bit. But first, to make these comparisons between different types of imaging, first you just need to know the basics of them. We have your classic 2D angiogram, which is an X-ray of your heart when dye is put into it that can be picked up by X-ray. They then can take that and quantitatively measure it through tracing by hand or also through computers. We then have CTA, or computed tomography angiograms, which also are X-rays of the heart with dye in your system, but they're 3D, they have a lot of images, and then using computers, they sew that 3D model together. And finally, we have IVUS, or intravenous ultrasound, where they put a tiny little ultrasound camera in your artery. They slide it so that they can get a cross section of your arteries and they can see inside the wall and they can see plaque directly. We all agree that IVUS is the best for that, but Danielle also said that CTA is a good enough imaging technique that it should be used in future studies on plant-based diets. Now back to this 2007 study, because the anti-reversal camp described it as the smoking gun, because it also looked at IVUS versus those 2D quantitative angiograms. The study used Pearson's R, which is a measure of correlation. It measures how much two things are correlated. If they're perfectly correlated, they are a 1. If they're not correlated at all, they are a 0. Generally, over 0.3 is considered correlated, over 0.5 is more strongly correlated, and 0.7 is highly correlated. The study seems to send mixed signals. As the anti-reversal party points out, yeah, there isn't a great correlation with plaque volume. That's definitely true, but and the quantitative angiograms did well on what is likely the most important score, the overall coronary artery score, which reflects obstruction, which would have the most impact on disease state. And from the conclusion, although the change in percent atheroma volume only weakly correlated with QCA changes as continuous variables, disease progression on QCA is associated with significant increase in plaque volume on IVUS compared with no angiographic progression. Progression is the inverse of regression, so just kind of interesting to flip it in the sentence. It would be disease regression on QCA is associated with plaque volume on IVUS compared with no angiographic regression. So that would be relevant to the studies. The conclusion of the study is that there is correlation between those angiograms and IVUS. Those angiograms still had correlation for metrics that matter a lot in heart disease, and the question here is total atherosclerosis being measured, or is it not being measured by angiograms? And that's what brings me to the next study, this 2012 study. This is also an IVUS versus angiogram study. It looked at a bunch of different methods for quantifying angiograms and looked at how correlated they were with IVUS. And they particularly looked at atherosclerotic plaque burden and atherosclerotic plaque area. Their conclusion was all scores correlated significantly with average plaque burden and plaque area by IVUS. And we're talking R values of 0.56 with the most common ones up around 0.7, so highly correlated. And I can't explain why one IVUS study showed mediocre correlation with plaque and the other showed pretty high correlation, but taken together, this seems to be a strong case for QCA finding regression. So if you consider IVUS a accurate measure of atherosclerotic plaque burden, and it correlates highly with these angiograms, then you have to say that angiograms can have meaningful findings here. Next, let's look at CTA again, those 3D angiograms, which the anti-reversal party said would be good enough for future studies to determine reversal. That means that if our 2D angiograms correlate highly with these CTA scans, then they should also be good enough to determine reversal. This study by Voros et al. Is another interesting study because it looked at all three of these measures. And comparing CTA and those quantitative angiograms directly, the results are insanely similar. We're talking about less than 1% variation in diameter stenosis. And this other study found a very statistically significant, pretty solid 0.6 R correlation for overall stenosis grading in QCA versus CTA. So you can't say one is good and the other is useless. The study also looks at another measure which is highly clinically relevant in terms of diagnosing CAD and severity, and that is fractional flow reserve. It's a measure of the disturbance of blood flow within the artery and a marker for the risk of your heart not getting enough blood, and it's used to determine whether or not a stent should be put in. Well, Voros and colleagues also looked at FFR and compared that to all three of the other imaging techniques, and it turns out that the 2D angiograms, for whatever reason, were the most correlated with fractional flow reserve of any of the three, more correlated than IVUS. And this brings me back to Ornish and how it was clear that they wanted more than just the angiograms to show that these stenoses were shrinking and changing. So him and his colleague Gould, who is a cardiologist, went and looked at another metric which they call stenosis flow reserve. They said, quote, "To definitively address whether progression or regression occurs in humans with risk factor modification, we performed multidimensional analyses of arteriographic stenoses to determine stenosis flow reserve as a single functional measure of severity incorporating all geometric dimensions of each stenosis." What is stenosis flow reserve? Well, they say it's a measure of severity integrating several dimensions into a single number, reflecting the capacity for increased flow through the observed geometry for a standardized aortic pressure. Complicated stuff. It is based on the concept of coronary flow reserve proposed 17 years ago by Gould et al. And has evolved into an accepted measure of functional stenosis severity. And they did, in fact, show that their intervention improved stenosis flow reserve. They say severe stenoses showed a 45% increased stenosis flow reserve. I don't know how that isn't reversal of stenosis. So I can tell this video is getting really long, so I'm going to accelerate a little bit through the next points, and one of those is PET scans that Ornish and colleagues have done. I agree. I'm pretty sure the other side thinks that PET scans alone would not determine reversal, but again, this is a total picture here. And from the American Heart Association, quote, "A PET scan is a very accurate way to diagnose coronary artery disease and detect areas of low blood flow in the heart." Another area I just have to mention more specifically is endothelial function, again, that inner lining of the artery. And we see from this study, which yes, it's on peripheral artery disease, but it measures things like nitric oxide, which is obviously going throughout your whole body and is super huge in terms of dilation and preventing platelet aggregation and stickiness of things like macrophages to lesions, which helps them grow into foam cells, and that's what pops and causes. Anyway, you get the whole point. But they measured a 240% increase in this case, and to me, this really contributes to reversal because it is not an external factor leading to this nitric oxide or this dilation. We are talking about a internal process that has regenerated so that they can produce nitric oxide again. Also worth mentioning, the study found increased artery function. Moving on. Here's the one I just want to mention briefly, and that is this study by Fleming, who put people on what I consider a plant-based diet. It is the same fat profile that other plant-based doctors use, and he kind of pinned low-carb people up against people on the more plant-based diet. They used echo. They didn't go crazy with IVUS or anything, but the regression claims are interesting because they were in the journal Angiology and they haven't been retracted. Not a randomized control trial, also worth mentioning, but in the low-carb group, they saw what he deemed a 40% overall progression of coronary artery disease, but the overall effect seen in the treatment group was a 23% regression in the extent of coronary artery disease and a 22% reduction in the severity of coronary artery disease, which was statistically significant. And that was over 12 months, again, just contributing to the general picture of things. And one cool, just anecdotal case study, we need more studies, obviously, worth mentioning is Osfeld's case study of someone with heart failure who was down at about a 20% ejection fraction, and they got them right up to the cutoff with a plant-based diet of 55%. you're over 55% and you don't have heart failure, so that's hopeful. And there's another interesting study here of 121 people worth mentioning. It was out of India, collaborating with the University of Alabama, using blinded QCA, and they broke 10% diameter stenosis shrinkage in 50% of their patients. It was described as a low-fat vegetarian diet, but with cholesterol less than 50 milligrams a day or a quarter of an egg, yeah, this is a quasi-vegan diet. Wasn't randomized, sadly, but at least it echoes the Ornish findings. It clinically demonstrates reversal with the 10%. Also, the more adherent, the more regression, which is pretty compelling. But it's worth noting they did medicate as well. In conclusion, there's just so much more going on with a plant-based diet in the literature than stenosis reversal. I believe there is a strong case for these angiograms showing true stenosis reversal, especially when combined with other metrics like that flow reserve. In addition, if you say that CTA is good enough and you say that IBIS is good enough, if you're seeing high levels of correlation for total atherosclerotic burden and you're making the claim about atherosclerotic disease, no, there appears to be a bit of a contradiction there. Same goes for the CTA scans. Very correlated. How does one work and not the other? And Ornish's previous study showing the 41% of subjects regressing past 10% absolute diameter stenosis. And we have so many other things in the literature supporting this. The lower event rate by 60%, not even counting the crazy lower event rate in Esselstyn's fully vegan diet. We're also talking about 30% lower inflammation. We're talking about way lower angina, the better endothelial function, on and on and on. So it's hard for me to feel like a crazy vegan making this claim when the case is strong enough for the Lancet, again, #2 medical journal. It's strong enough for the NIH. It's strong enough to be accepted and paid for by Medicare and insurance companies. Finally, there's a lot in the discussion of can what you're claiming be used to validate a carnivore diet reversing heart disease? And I think it's very clear based off this comprehensive view of heart disease that a carnivore diet, keto diet, low carb diet, none of them come anywhere close to reversing heart disease based off everything that I've shown. So finally, my message to the anti-reversal party, I just think that we agree on way more than we disagree. And hopefully, I doubt it, but hopefully some of these points you agree with, probably not. All right, let me know what you guys think down below of all of this. I already know that most of my viewers want to believe that a vegan diet reverses heart disease or a plant-based diet reverses heart disease. And for me, it's been a journey seeing all of the data. So let me know what you guys think about this. Do you think this is a valid definition of reversal of heart disease? If not, let me know why. Whether or not a plant-based diet reverses heart disease, if it does, that doesn't mean that you should just ditch all modern medicine. They seem to work really well together. And as usual, feel free to like and subscribe, and I'll see you in the next one, which will not be nearly as long.